messages. It may be helpful to look at just a few of the ways they investigate personal health with this assessment. One of the best ways is through one-on-one counseling, which is available in Wisconsin, which should be also started here at the AIDS HIV programs, designated counseling and testing sites. Education of adults is also important. Members of the AIDS HIV Education and Service Network must have access to current and accurate information so they can maximize their effectiveness in educating their clients, patients and peers. In addition, current and accurate information must be given to the general public. In Wisconsin, these efforts are achieved through a quarterly publication, the Wisconsin AIDS Update, media campaigns, development of guidelines and brochures for specific settings, initiatives for racial and ethnic minorities, and informational seminars and workshops. The next is a school-based education and education of children and adolescents. I think in India, this is one of the most important ways we can affect change and how to prevent HIV infections among children and adolescents. They must be given age-appropriate information in a forum where discussion can occur and is encouraged. Each primary, middle and senior high school in Wisconsin of injectable drugs. By participating in only mutually exclusive monogamous relationships, in having a single uninfected partner used. Another important part is education of healthcare workers. To provide the best care for our citizens and healthcare workers must be kept up to date on recent advances in the diagnosis and treatment of persons with AIDS and HIV infection, as well as how to prevent the occupational exposure of HIV in hospitals. In India, it's heartening to note that there are several physicians not willing to treat HIV or AIDS patients. I think it's because of lack of ignorance. Care and Share is bringing out a primer for primary healthcare professionals, which will be distributed free to all physicians. It tells them how to diagnose, how to look at the various gloves, masks, and goggles should be used if there's a possibility of exposure to or splattering of body fluids. A healthcare worker has any open lesions, these should be covered. Equipment contaminated with blood or body fluids needs to be disinfected, sterilized, or properly disposed of as appropriate. Specifically, needles should not be cut.
Oh yes. Since we didn't have much of information, we thought isolation of these girls from the society will be the answer. So as a result, these girls were isolated and confined to a solitary confinement was the result, which was opposed by many of the social welfare organizations in the early days. They said it is inhuman. And finally they went to the court. At the time, instead of the microbiologists who said that these girls are affected with the AIDS disease, they didn't come to the court, and whereas the venereologists were taken to the court. There we said, it is only the HIV positive. We are not very sure these girls will later turn out to be full-blown AIDS cases or not. And we cannot assure the court that these girls will definitely become AIDS positive cases, and we are not very sure that these girls will transmit the disease also. When nothing is sure, the court said, release those girls. 2 of them were released, and finally all of them were released. But we didn't stop our investigations and screening procedures. Continuously we were screening all the patients at a corporation block also. Whereas more than 800 cases out of 15 population. But now we see, to our surprise, there is an increase in the positivity rate. We don't know the reason why. But still we have some reluctance in accepting the microbiological study as far as our country is concerned. How far these microbiology studies reflect the disease process in the body is an open question which I don't know. At present there is no answer. But the reluctance among the medical profession in other parts of the world has resulted in the uncontrollable increase in the AIDS cases. This is what we learned from the recent Zambian visit to, we visited Zambia, where we learned that initially in every part of the world, the doctors were reluctant to accept that there is AIDS in their society. That resulted in the delay in the preventive activities. As a result, the uncontrollable incidence of AIDS has taken place. So that kind of mistake we should not commit here also. So we have taken up this AIDS prevention activity very, very seriously. In the year 1990, a kind of social reformation took place. That is, the girls, the female sexual workers from Kamatipura, the related area in Bombay, about 800 of them belonging to the state of Tamil Nadu, were brought with the help of police and social welfare organizations of Bombay and Tamil Nadu, brought here thinking that these girls can be rehabilitated, put them back into the society, so that the society can accept them and they can be reformed from doing prostitution and they can take up a kind of acceptable profession by the society. Curiosity's sake, we asked the government to do a screening test on these girls. But to our surprise and disappointment, we found about 700 of them are positive for HIV. Only the 100 girls were not positive. Maybe they are in the window period. Suppose if we conduct now, they may also turn out to be positive. That created a big panic in our mind. Because in Bombay, prostitution is tolerated and it is open. Whereas in Tamil Nadu, in Madras city, there is no red light area. The prostitution is not open as it is in Bombay. How to find out these prostitutes? How to screen them? There is no method by which we can assess the incidence of HIV positivity in our state. So now we don't know. We are in a crossroads. We are in a very, very big confused situation. How to find out these prostitutes? How to screen them? And after screening them, how to follow them up? How to rehabilitate them? These are all the certain problems. Unless some solution is found out for this, the containing the AIDS disease in our state will be very, very difficult, almost impossible. And if that state is going to continue, I think the future generation will be AIDS infected generation. At present, most of our policy makers thinking that it is not their problem, as if because none of them are suffering from this problem. But we created an awareness to them in this same hall. Once they reach the adolescent stage, they may get into problem. Then it becomes your problem. So nobody should think AIDS is not their problem. It may not be affecting that individual, but it may be affecting his family, his community. So nobody can be away from AIDS. Some of the people who are not belonging to this profession may think that it is not my concern. Why? Because my next person is a bank officer. He may be thinking, what am I going to do with this? You have a responsibility, sir. Everyone has a responsibility. It is a disease of man, human being. Every human being has a concern with this disease. So this is what we are trying to impress. Now at present, with the Health Secretary, Mr. Inbasagaran, have taken up this portfolio. Our activities have geared up. Now the government is taking every step. We are giving a very serious attention towards the prevention of this AIDS problem. Now at present, we are involving the folk arts like Villupattu, puppet show and other things we have developed. Most of you may be knowing the popular Villupattu person, Mr. Subba. He has developed a very beautiful Villupattu and he is playing this show in various parts of Tamil Nadu, which is very, very successful. And we also engaged in the peer group activity. So you be careful. You stay with one partner. If it is not possible, it is not always possible to stay with one partner. We can talk theoretically. As for example, the truck drivers who remain away from the family for months and years, they cannot control their sex, control their temptation. It is not possible. Humanly, it is not possible. In those situations, how to have safe sex? The only way out is condom. The condom promotion is being very actively carried out in our country, in our state. But unfortunately, the required type of condom is not available. But for which there are some funding agencies like WHO, World Bank and USAID. For information, United States Agency for International Development, which is a part of US government, has taken up Tamil Nadu for their AIDS prevention activity. We are lucky in that. So they have developed a lot of programs for this. And similarly, World Bank has also developed some programs, and they are going to give us about $110 million, which can be about $20 million can be diverted to Tamil Nadu. Like that, there are various funding agencies coming forward, but money is there. But how to approach the society? Here I see Madam Sara Chanda and my teacher, Dr. Sundari, are all here. Tell us how to approach the community. Our community is a prude community. You know what is meant by prude? We don't talk of sex. When we talk of sex, it is immoral. For example, our TV people, when we approached, whether you can show some slides, some information, some film strips that are in a prime time, they are reluctant. Whereas in Star TV, I see Jackie Chan every night, every day, talking about AIDS. Whereas here in our midst, the superstars are there. When we talk about, why don't you talk about AIDS means, no, I'll be stigmatized. So I cannot come up. This kind of stigma is attached to everywhere. So how to come out? How to break these barriers? Non-governmental organizations or NGOs can come out and help us, help the government organizations. And I look forward to Mr. Joe Anthony and my dear Vijay Prabhakar. I have a lot of confidence in him, and I have a lot of hopes that he will bring something which will help us. And as such, I cannot give you the statistical data, because even in state it's only a tip of an iceberg. Here even the tip is not. So that is the situation. What of the stats I am going to offer cannot help you. But it is there. Now we are seeing full-blown AIDS cases. Last week we have lost 2 cases.
I received the news very late, so you must excuse me for being late to this discussion. I'm sure I've missed out on something. Right now, if you would take a look at your agenda sheet, there is a misprinting in your sheet. Under the subheading, Care and Share Activities Update, the name should read Dr. Jose K. Jacob, Treasurer, Care and Share Incorporated, USA. I kindly request you to make the change. It's Dr. Jose K. Jacob, Treasurer, Care and Share Incorporated, USA. Oh, it's Jose T. Jacob. We will now move on to the next item in the agenda. The topic is AIDS in India and an update. It's by the Care and Share. We've already had the local doctor from the government briefing us. Now we will listen to Dr. Prabhakar and Mr. Joe Anthony, who are going to talk about the Care and Share HIV/AIDS plan of action. Over to you.
Consideration that we are doing is to have an institute. We are thinking about located either in Bombay or Madras, depending upon the cooperation from the government. We submitted a memorandum to the government of Maharashtra, as well as we are going to do the same thing in Madras. If the government is going to give us free land, we are in the process of bringing a hospital sometimes in the nearest future, strictly for the AIDS patients. As you know that there is no treatment, but at least we could have them in the hospital. At least their days they can live in the hospital peacefully, and they will have a less painful death. The other initiatives to be implemented during the phase 1R with the good night publications in Bombay. We will be publishing a AIDS Samajar, which will be distributed to different chapters of Care and Share, and through your groups you could distribute to the other community organizations as well as the people. And phase 2 will be the institute project shall be transfer of technology through the University of Illinois at Chicago School of Public Health beginning in June 1993. Care and Share shall be in cooperation with the International Education Service will host an annual postgraduate summer institute in India, and that shall lead to a formal postgraduate degree in Masters in Public Health with a focus on AIDS and drugs abuse and prevention. And then participants who enroll and successfully complete the 2 consecutive summer institutes shall be awarded the respective master's degree from the University of Illinois at Chicago. These institutes will be conducted by the University of Illinois faculty on an annual basis through the agreement with the Care and Share USA. This shall be the first time a US university shall be offering such a postgraduate program in India on an ongoing basis. Then phase 3 of the project includes the opening of the hospital that I was talking about earlier. So those are the programs that what we have. Besides this, we met with Dr. Natarajan in Bombay, and we had a wonderful, successful meeting. And we also started a research center on AIDS and eye in Bombay, which shall be established. I should say we already started that project. The AIDS and eye research center shall be maintained and operated by the Aditya Jyoti Eye Research Trust. Care and Share India shall provide the financial resources for the center. So these are the key programs that we have in mind. And like Dr. Kandraji was asking what we are going to do from here, I think we should, after lunch, we will discuss it further and we will come up with some solid programs. Now I will give the microphone to Vijay. Vijay is going to share a few other ideas also.
I think, as Joe's pointed out, we're going to have the hospital-based institute project is going to be implemented in 3 phases. Phase 1 would be kicking off the Care and Share AIDS awareness campaign in India, which would include the opening of a Care and Share AIDS ETC, we call it Education and Training Center, like etc., which will start from August in 1992. And this shall offer AIDS education for health professionals, paraprofessionals, and community activists through workshops and refresher courses. We plan to have the first such course the first week of August with some international faculty and experts to come down here, and we're opening the enrollment not only to professionals in India but also to other South Asian countries, Sri Lanka, Pakistan, Bangladesh, Myanmar, and Bhutan too. It's most likely it will be held in Madras, and then a mass media campaign will also be launched in September, which includes radio spots and TV spots. We have written to the Union Ministry of Information and Broadcasting requesting for using it as a public service announcement. We're also happy to announce that the famous cine playback singer K.J. Yesudas has accepted to be the honorary spokesperson for the Indian AIDS awareness campaign. He will be with us tonight. And he would be able to record the radio spots and TV spots. And in development of those spots, if you all, the Care and Share groups and other community activists will give us some ideas, it will be very helpful since you're already doing the things of that nature. The other thing is we're also trying to rope in other stars and personalities like Kapil Dev of the cricket field. We made some contact and some person in Bombay and some other film stars in the Hindi as well as other to come out and make statements as part of the AIDS awareness campaign. Another thing, part of the phase 1 would also be a primer for primary healthcare practitioners. The primer will attempt to describe the most frequently seen illnesses in India, how they present, how to diagnose and treat them, and what common adverse effects to monitor. And I think the problem is most of the physicians are having problem in trying to diagnose AIDS, and also we have the stigma attached and we don't want to treat them. So we want to give them an update and give them continuing education in that field. And then the primer will be printed primarily in English. We have talked to Goodnight Publications in Bombay, whose president, Mr. Mohan Kalyan Raman, is being installed as the chairman or president of the Maharashtra Care and Share chapter. And we'll also, as we said earlier, release a quarterly publication for the common men called AIDS Samachar, which should be readily available in 7 different languages with some good color pictures of things in different public institution points to speak up, not only in doctors' offices and railway stations, bus stands, airports, everywhere else, like a mass media campaign. That would all encourage phase 1. Phase 2 is something which we talked about what is needed in India. We have got a collaborative agreement with the University of Illinois School of Public Health. They are willing to bring their faculty down to India and give formal degrees for master's degree program in public health, master's degree in social work from the University of Illinois, as well as certification program for physicians who want updates on clinical practice and diagnosis of AIDS and IV drug abuse, as well as hospice management. Hospice is the thing of care of the dying of the, letting the people die. It will be the first university, American university, to award degrees in India. So we have two summer institutes, June, July and August, and then in between 9 months they do the field practical. Physicians could take the course as well as social workers and others too. There'll be 2 programs which will be offering, postgraduate degree programs. And we have worked, we tried to make contact with the union ministry people in Delhi regarding the actual agreement and how it's going to work out. I think it will be, we'll be involving the Amar Dayan Education and Research Institution of Tamil. They will be in Adiyaman Education Institute's Research Foundation is their institution to be offered to them. It will be the first of its kind in India. And the phase 3 of the project, as Joe said, will include the opening of the 250 hospital-based institute in September, hopefully, of 1994. And for that, we plan to have today and tomorrow appoint a steering committee of not only some of you all who are present here today, but others in Bombay and Delhi who expressed interest to be part of it, from land acquisition to the laying out the model plan and how it's going to be effective. It will also be not only for AIDS, it will also include the other sexually transmitted diseases, and also a critical care hospital. Because you see, the different AIDS is the disease, but they all die of different opportunity diseases, pulmonary, neurological complications, of very critical care. So it will be a kind of a critical care hospital too. We have received enthusiastic response from the government of Maharashtra. The Maharashtra Public Health Minister has met with us, and he is very keen to have the institute, hospital-based institute in Bombay, and he also wants to have the most of the projects launched from Bombay. But we thought we'll, since our roots are in Tamil Nadu, try to give Tamil Nadu first preference. If the government of Tamil Nadu doesn't give us the land, we'll purchase the land. And in Maharashtra, we told the minister is hosting a lunch for us again on April 9th. I won't be able to go, but Jose and Dr. Jacob would be going there. And he wants to make sure that he could tie into the Care and Share's resources. As he says, any resource from anywhere is welcome. And I think he's got a very positive attitude. Dr. Natarajan has his Aditya Joe's eye hospital there, and he has started an eye research trust. So we spoke to him, and his father-in-law donated 2 floors of the building for the AIDS and Eye Research Institute in Dada TT while we were there. And the Care and Share should provide the financial resources for the center. And then hopefully by September of 1994, that should be fully functioning. That will be the first AIDS and exclusive AIDS and Eye Research Center, not only in Asia, but I think in the whole world. Retinitis and loss of sight is another complication, and then this other things. So this is what we are doing, but we want to hear from you all. We might change all our plans. Care and Share Board of Directors have allocated $10 million for the project so far. Whether it's going to be used in phase 1, phase 2 or phase 3 is yet to be seen. But it's up to you all to tell us what is needed here, how is it to be done. Because this is all, we have done this just on the basis of what we read back in the US and the little interaction we had with people in Delhi and Bombay. So we are open for suggestions, amendments, can come out with an entirely different plan. But we'd like to know what is needed and how is it to be done. We would definitely take up Dr. Kantaraj's challenge. We'd like to share ideas which have worked successfully. I work with the Native American, the American Indian population in the United States. And they're very much similar in cultural and political and social like our Indians. And we work with the population. We've done several things which have successful strategies for them. And also we work with Cayman Islands, it's another minority population. I've been their consultant, and also for the National Institute of Health Education in China. And they're all very conservative populations like us. So the problems are the same, which I have experienced, which the Indian community, the stigmatization, they're not willing to listen, not willing to think that AIDS would affect them. They think it's a white man's disease and things like that. But I'm sure we can share experiences and find out solutions how best we can implement this problem. Thank you.